This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today, we'll be talking about the role of veterinary professionals in food safety. Joining me on the program is Ms. Sally Farinha, Dr. Clara Frederick, and Dr. Silene Ramjohn, all from the Veterinary Public Health Unit of the Ministry of Health. Welcome to the program, Ms. Farinha.
Thank you for inviting the Veterinary Public Health Unit to participate in this program.
We're actually happy to have you guys on the program today. Today we're talking about the role of veterinary professionals in food safety. Since it's your first time on the program in a while, we want to hear a little bit about some of the functions and the responsibilities of the Veterinary Public Health Unit. Tell us about that.
So the Veterinary Public Health Unit has been a part of the Ministry of Health for the past 53 years. Yes, August the 8th we're going to be celebrating our 53rd anniversary. So our mission statement is to promote human health by taking steps which will minimize the risk of diseases transmitted between vertebrate animals and man. So that is referred to as zoonoses. And there's several diseases that are zoonotic.
Wow.
And also by food derived from animals. So the transmission of these diseases can happen both directly and indirectly. Yes. And so that is the VPHU's purpose. And so all of our activities surrounds accomplishing that purpose or that
goal.
Mission. Yeah. So, this is being done to carry out several objectives. The Veterinary Public Health Unit being the interface between human health and animal health. We do a lot of collaboration with all of our sister agencies or sister ministries. Our work cannot be done without, collaboration. Yeah. So its focus is as it relates to public health, food safety.
Food safety.
Food safety. So food safety and food security in that for the food coming directly from animals, we have to also ensure that those animals are healthy.
Indeed.
Right? Before it gets into the food chain. So most of our work, the services that we provide, inspection, right, of these establishments that produces food from animal sources, and also the certification of those foods, because Guyana export and import food of animal source. Mm-hmm. So that is where we're most of our work, all right, is being done around inspection and certification.
Wonderful. You guys have been around for a number of years, as you mentioned. How has the public responded to your work? I know you guys would do a lot of field work as well. You will visit markets, different food establishments and so on. How has the public responded over the years and even curb some of their practices to best suit the standards that you guys have set?
Yes. So one of our objectives is to sensitize the general public, to train all the stakeholders. So stakeholders include even our collaboration partners, and there are times when again, this word collaboration, we're always collaborating. So we will come together as a team to train the food handlers, different food business operators, whether they're dealing with processed food, they're dealing with products from animal source. So training is one of the main areas where we reach the public, and also through our public sensitization programs. So we would usually prepare infomercials. We have our print material as well. And, we will go out into the regions most time as a team, especially around World Food Safety Day, World Food Day, to train those stakeholders together as a multi-sectoral or an intersectoral team.
Indeed, and that is important in reaching that goal that you mentioned earlier.
Yeah, and the response, as you had asked, is good. So actually, in this year, based on feedback from the public, from the food vendors, especially those in the markets and so on, where one of the food safety practice is to keep your food chill,
Yes.
especially these food from meat products. But there was, or I should say, there is a resistance at a certain level, especially in the marketplaces where the vendors are saying to us, when they chill their food, and chilling most commonly is being done at the market or the roadside by the use of ice. They would say the consumers, right, is resisting that because they're thinking it's stale. And so based on the consumers resisting them chilling, they too don't want to implement or carry out this practice. So with that feedback to us, we have decided we need to do a national Keep It Chill campaign.
Wow.
So what we first did was to prepare these infomercials. We had them aired for World Food Safety Day. That was during the week of June the 6th. It's always June the 6th for World Food Safety
Yes.
Day. And we're hoping that these infomercials, they can be put on those big, those big billboards and so on, and to have more programs like these
To
where
sensitize.
the consumers at all level will understand the importance of that. We know in the supermarkets, those products are in the chill cabinet, but our concern, right, is for the vendors on the road, in the marketplaces. We need to work on that.
Indeed. What are some of the key strategies and initiatives currently being implemented to promote and ensure good food safety practices, especially in food establishments? And you also mentioned the markets earlier.
Yes. So when it comes to the markets, in Guyana, our food surveillance or inspection system, it's multifaceted in that we need to go as a team,
Yes.
right? Because we have some of our sister agencies, the environmental health officers, the food and drug officers. You also have the GLDA officers. These are all the food safety authority. So we would go together as a team to carry out various inspections. As it relates to the veterinary public health unit, we have our inspection procedures, the inspectorate department. So of course, we have to inspect to make sure the food is safe and of best quality before it can be certified.
Indeed.
Right, for export. Part of that inspection includes verification of their good hygiene practices.
Yeah.
And so on. So we would do sampling. We would collect water, product, environmental, meaning we would swab those food contact surfaces and take it to the government analyst food and drug department to test for these pathogens or these harmful germs that is of public health risk. We were recently accredited as an inspection body and a certification body
by the Jamaican National Agency. Tell us
JANA
about
Global, which is an accreditation body.
Wonderful. I'm so happy to hear about all the work that you guys have been
we're
doing.
hardworking unit.
Across the Ministry of Health and the regions as well. I'm excited to hear. And I know the public, I know many persons are sitting at home or, maybe getting to work or just relaxing a bit. And this is news to them because they didn't even know about the unit or, what you guys do. So we're happy to have you guys on to be able to share. We're going to go into a short break and be right back.
Food safety is important since it contributes to food security, human health, agriculture, market access, tourism, economic prosperity, and sustainable development. The Ministry of Health, through the Veterinary Public Health Unit, together with other departments, provides assurance for everyone to have access to safe foods. The only way to ensure food is safe for consumption is by handling, preparing, and storing it in ways that prevent foodborne illnesses. Did you know that food becomes unsafe when it gets contaminated with food safety hazards? These hazards can be placed into three main categories: biological, chemical, and physical hazards. These types of hazards can cause a person to suffer from more than 600 diseases, ranging from food poisoning to various types of cancers. About a third of these diseases are zoonotic, which means they are transmissible between infected animals and humans. Biological hazards are living organisms such as harmful bacteria, viruses, fungi, and parasites. However, food can also become unsafe when they encounter chemical hazards. So be careful with the usage of cleaning products, fertilizers, and pesticides. Labels must have a declaration of preservatives and allergens. Objects such as hair, fingernails, broken glass, staples, or even plastic packaging are physical hazards. Farmers must also be mindful of the abuse and misuse of antibiotics when treating food animals suffering from infections. Over time, animals can develop antimicrobial resistance to harmful germs. This resistance can be passed on to humans through unsafe food produced from the affected animals. Food safety must be maintained at all stages of the farm-to-fork food chain, and this can only be achieved with good agricultural practices on the farms and continues with good manufacturing and best practices in the production of food for sale. The stages of the food production chain include harvesting, preparation and processing, packaging, storage, and distribution for sale in shops, markets, and other places where safety must be maintained. Farms and food production establishments should ideally be in areas free of environmental contamination with easy access to adequate water supply and waste disposal. The design, layout, and suitable facilities must protect against hazard contamination. The control of the operation, including maintenance of time temperature control, sanitation, personal hygiene, and training of stakeholders are all important to ensure that food retains its wholesomeness, safety, and nutritive value throughout the production. When it comes to preparing food, it is recommended that personal protective equipment, PPE, is used by food handlers at the farm or in the processing plant, markets, retail outlets, restaurants, and other places of production and sale. Given today's global pandemic, it is advisable to also wear a face mask and maintain physical distancing for protection against COVID-19. Farmers must also adopt sustainable and suitable farming systems with improved hygiene and stress-free handling of animals. By practicing good hygiene, farmers and manufacturers can help prevent pollution to the air we breathe, our water sources, and land. But most importantly, consumers can play their part in the home by using the 5 keys to safe food. Keep it clean. Separate raw and cooked foods. Cook thoroughly. Keep food at safe temperatures. Use safe water and raw materials. Practice regular hand washing, especially when handling food to prevent cross-contamination with hazards that can make food unsafe. Apply hygienic practices to handle, store, and prepare food. At the Veterinary Public Health Unit, the VPHU, our mandate is aimed at promoting human health by taking steps to minimize the risk of diseases transmitted between vertebrate animals and man, zoonosis, and by food derived from animals. Our relationship with other ministerial stakeholders and partners allows us to build and maintain an adequate food system and infrastructure to better manage food safety risks, in addition to how we respond to adverse events such as a disease outbreak. This approach by the VPHU improves communication and joint action to enforce local and international food hygiene requirements, which are imperative for food security, human health, economic prosperity, agriculture, market access, tourism, and sustainable development. Food safety is everybody's business. Let us all do our part to ensure that the safety of food from the farm to fork is safe for a healthy tomorrow. For more information on food safety, contact the Ministry of Health Veterinary Public Health Unit, Lot 216 Lamaha Street, North Cummingsburg, Georgetown. Telephone number 592-223-9706 or 592-223-9712.
Ms. Farinha, how has your unit been adapting to emergency risk in food safety and public health with regards to climate change?
So, with the food that comes within our jurisdiction, fishery products, all right, for years now, we have seen how that industry has been impacted. You know, we have seen resources being depleted, and so we have been hearing from our clients in that sector about, raw material is low, and so they're experiencing low production. So that's one way, yes, feedback. But to the question, how is the unit adapting to that? Well, what it means is that our work may become, our inspection may become less, but nevertheless, there are seasons to it. So even though we're hearing that, production is low, we still have to go and do our work, all right, inspecting and, certifying products. I don't want to speculate, but I know that our country, we're trying to promote aquaculture, right, to deal with climate change that is affecting our wild-caught industry. Yes.
What advice would you give to consumers with regards to best practices for ensuring the food they purchase are safe for consumption?
Yeah, so, there's so much information now, right, on social media. You can go educate yourself, all right? you can come to the VPHU or any one of our sister agencies. You can visit our website, the Ministry of Health website, the government analysts, or the Food Safety Authority, GLDA website to get information on food safety. WHO, PAHO, they're the 5 keys, you know. Keep it separated, keep it clean, cook thoroughly. When you prepare your food, keep cold food cold, keep hot food hot, and there are those specific temperatures there. Use clean water. So those, we refer to them as the 5 keys, all right? But to go a little further, for any food product, whether fish, poultry, beef, or any meat, educate yourself. Know what is the normal. We're going to use our 5 senses now. How does it look or its appearance? Is this normal? Is this abnormal? How does it smell? You know, and we know when a fish goes bad,
Correct.
we get that very pungent, or we can say stink, you know, rotten smell, right? Touch it, feel it,
How does it
right?
feel?
Yeah, whether fish, poultry, or any, the texture changes because there are all these chemical breakdown when an animal dies, right? So if it's not being stored at the right temperature, you can have deterioration setting in, and that changes, right? The biochemical, natural biochemical of these products start breaking down that quality internally, right? And that is what we will see, right? Reflected in the quality. You will have the change of color, the change of texture when you press it. For instance, a fish, when you press it, it will not bounce back easily because that muscle is beginning to become flaccid and soft. And rub the scales. If the scales fall off very easily, you know the quality is not good. All right? So the eyes, you know, they must be bulging, well, not coming out, but, you know, but have that nice convex shape. The gills, when you lift it up, it's red. And for other meat, you know, beef, you know, it must have that natural brownish color. What we find happening, and you can look at it in the supermarket, we're seeing artificial coloring is being added to make these products look fresh, and we have to be careful with that because some of these colorings or any additive, they can become a chemical hazard, all right? And so one of the things that we would do in our inspection is look for these critical limits, all right? Look for these critical limits because any additive can become dangerous as well. So to the consumers, I would say, educate yourself. The information is out there. Just make sure that you go to an authentic source.
Yes, looking ahead, Ms. Farinha, what are the priority areas for the VPU, or what are your future plans? What can we look forward from the department, or look forward to from the department?
Well, we want to continue to ensure that food is safe and wholesome. And so we have to maintain our management system. All right, so to do that, we look for gaps, you know, in our systems, our inspectorate system, our certificate system, to see how we can fill those gaps, how we can strengthen the weak areas. We have received accreditation. That is testament to, you know, what we're doing.
Good work.
Yeah, but we want to we want to always be ready and prepared to deal with any task that comes to our unit. I know right now we're working towards lifting the catfish ban, and so whatever the requirements for us to do so, together with our other partners, we will do our best to do so.
Wonderful. Thank you so much for joining me in the program today. I want to encourage you and your department to keep up the good work that you guys have been doing at the VPU.
And thank you again on behalf of Dr. Dotson, who is our director, and all of the staff. We want to thank you for affording us this opportunity to be here and share with the public the services that we use. And if you need any further information, just contact the Veterinary Public Health Unit. Presently, we are at 216 Lamaha Street, North Commonsburg.
Thank you.
You're welcome.
Dr. Ramjohn, could you tell us a little bit about foodborne diseases?
Okay, so there are different types of foodborne diseases. Some are considered to be zoonotic, and others still make an impact on human life. So, first, as some examples of the zoonotic foodborne diseases, it would be like leptospirosis, which everybody could associate with the
Yes.
rodents. And there is also something called tuberculosis. You usually get that with infections in cattle, and you also have rabies. So, some of the general foodborne diseases that is popular or not so popular at the home front would be E. coli. I'm sure everybody has heard that before. There is also something called listeriosis, and I think everybody knows about something called salmonellosis, but it's not really associated with salmon, but you know, you get my drift. But it
Yeah.
can happen, right? But those three that I just listed, they are very harmful germs. They are actually bacteria, and they exist in many different meat products.
Those are very prevalent here in Guyana. Is it something that we see?
So yes, we can see it, and it can occur with either the meat products being infected, or it can happen. It can occur where the meat products are getting infections from where they are being processed or where they're being stored, depending on your hygienic protocol of the establishments.
Okay, what are some of the symptoms of these diseases?
So one thing about all these diseases, even though they have different names and they're different germs, they tend to have similar symptoms. I'm not gonna say they're similar to a past pandemic, but you get the drift. So
Yeah.
they will usually cause fever. They can usually cause nausea and vomiting. You can also have diarrhea. And when you have a lot of these germs, whether it is one or all of these germs, you can also get it to affect your nervous system.
Wow.
So, on a side note, other than all of these things, all of these symptoms occurring, you can also get severe dehydration because you will be vomiting, you will be passing more stool than usual, so you will lose a lot of fluid.
How does the department deal with these diseases in terms of sensitizing and bringing awareness to the public as well?
So when we as a department, the VPHU, we go to different establishments, we will do our inspection throughout an establishment. Our inspection starts from the reception area, which would include reception of the raw material, to the end, which includes distribution of products to the supermarkets or exportation. So as we go through an establishment, we will be looking to see what are the best practices implemented in a establishment, such as your cleaning procedures, the different processing that you do, the procedures that are associated with these processing, and also how you distribute and store your product as well, because sometimes distribution does not happen on the same day. Throughout all of these steps that I've just mentioned, we will also do something called sampling. So we will ask for permission to do sampling throughout your establishment. So we will either take water samples or product samples or both, and we will also do swabbing as well. What this will give us is that we will be able to do testing. We will submit it to the Food and Drug Department, and they will carry out certain tests. We will request different tests to be carried out on these samples that we submit. Once we get our results, we will now look to see if there are any germs, like what I've mentioned before, are present in any of these products. If they're not in the acceptable range, we will notify the establishment, and then further recommendations will have to be implemented on our behalf. Well, we will recommend further changes that need to be made, and the establishment will now have to do this. And in a case, for example, if there are an unacceptable quantity of germs, I would say, to make it easier for everyone, we will resample. So we will let the establishment take into consideration what we found and give them a chance to change what is happening at their establishment, whether it be doing treatment of water, for example, changing the way they do their processing. These are just broad examples. And then we will resample to see, okay, so changes were done and things are getting better. And now the food is going to have an acceptable limit of organisms or no organisms at all. Yeah, before they're distributed a second time or third.
Dr. Fredericks, could you highlight some food safety practices, not only for vendors and food establishments, but for also for consumers as well?
First of all, I would say food safety refers to practices and procedures used to prevent foodborne illnesses. One of the things that we do when we go to the establishment, we advise those persons that are processing those raw materials to, wash their hands before they go into the establishment to process the raw materials and to avoid as much as they can cross-contamination from the raw materials that they are processing from the ones that are frozen or ready to eat products that they carry out in their establishment. And other things that we advise them on doing is to clean and sanitize surfaces. What we mean by clean and sanitize those surfaces, we mean the utensils, the equipment, regularly, spread bacteria within the establishment so they can clean properly before they go into production.
And this should be something routine as well, because I know even during the COVID-19 pandemic, persons were encouraged to do this and to, frequently wash hands before preparing meal, after using, any utensil, washroom, all these things. So, these should be normal things now for us. But of course, we want to encourage persons that, these simple things are important, especially in food safety. Thank you for staying tuned with us. I'm Alicia Martin saying goodbye for now.